I'm going to give a minute for folks to come in, then we're going to get started here. So I wanted to welcome everybody to On the Park Bench, a public square conversation brought to you by the Congress for the New Urbanism. And On the Park Bench presents interactive conversations with thought leaders in new urbanism and allied industries, providing an opportunity for the audience to engage in real time. And today we have Healing Small Cities with Rebekah Kik, Mark Fenton, and Marsha Garcia. Register for coming webinars, and we've got one coming up March 7th. These are all at 12 noon Eastern time, and there will be a discussion of building urbanism on sites related to houses of worship and faith communities in cities. March 21st, we have one coming up on parking reform trends nationwide, and April 11th, join us for a conversation with urban designers and architects involved with the cul-de-sac Tempe and cul-de-sac Atlanta developments. And these are two highly watched projects that are eliminating cars in residential areas, which allows for innovative urban design solutions. Go to cnu.org/resources/ontheparkbench to register. And don't forget, CNU 31 Charlotte is taking place May 31st through June 3rd in one of the most diverse, vibrant cities in the American Southeast with deep roots in new urbanism, the Queen City of Charlotte, North Carolina. Learn more, cnu.org/CNU31. And join or renew your membership. Become a current CNU member and save $250 off of your CNU 31 registration. Can't beat that. Check your membership status today at members.cnu.org/memberships. And we've got a great show for you today. Rebekah Kik is Assistant City Manager at the City of Kalamazoo, Michigan. She has architecture degrees at both Andrews and Notre Dame, two schools that are noted for their new urbanism focus. And Rebekah has traveled the country creating designs for small homes, historical facade renovation, and infill in existing neighborhoods. And now she's focusing on economic and planning models for sustainability in the city of Kalamazoo. Mark Fenton is a national public health planning and transportation consultant and adjunct associate professor at Tufts University's Friedman School of Nutrition, Science, and Policy, and former host of the America's Walking series on PBS television. He's author of numerous books, including the best-selling Complete Guide to Walking for Health, Weight Loss, and Fitness. He's part of the Blue Zones team, which focuses on longevity and community design, and works all across the country in cities of all sizes. Marsha Garcia is a director of education and training at CNU. Prior to CNU, Marsha was the University of Rhode Island's campus sustainability officer. I'm Rob Studeville, editor of CNU's Public Square. And today's discussion is all about small cities with a particular focus on health and sustainability, as well as the economic case for making small cities walkable and livable. Rebekah will focus on Kalamazoo, a city of 73,000 people, while Mark will offer a broader perspective in the many small cities he's worked in nationwide. First, there's going to be a presentation, followed by a conversation with Marsha, and then Q&A from the audience. So we want a good discussion today. Please be ready to use the Q&A function of Zoom to ask your questions as they occur to you. And now I'm going to pass this along to Rebekah. No, I'm sorry, Mark is going to present first.
Thanks, Rob. It's great to join you guys. I'm only laughing because we only talked about that 30 seconds ago and we said, okay, so who's going first? Mark's going first, but we still, no, great to be with you. I'm going to broadly define small, if I may. And Rebekah, I think you're with me on this. You're going to see pictures in my few minutes of comments here that range from cities of 2,000 up to 200,000. But I think there's really a sweet spot in the 20 to 100,000 range. And I say sweet spot because a lot of recent evidence suggests Americans are very interested in living those sized communities. National Association of Realtors and things collect data on this. And lots of folks want to live in these kind of mid to small sized cities because they have much of what they want, but they aren't overwhelmed by traffic and things like that. Rochester, New York, interesting at the upper end of this scale is I grew up in a small town outside of Rochester, but it's an interesting community because it's modeling some of the move back toward new urbanist ideals and active transportation specifically, which I think is central to these principles. It was a classic city, kind of Rust Belt-ish city in the sense that it had a 1950s era ring road or trenched highway called the Inner Loop that sliced right through the city, separated historically Black and Hispanic neighborhoods from the downtown area. They envisioned in the early 2000s trying to fill that in and create a mixed-use corridor, multimodal corridor above that. And in fact, by 2016, this is the same view in the pictures on the left there. They were actually starting to tear up the eastern portion of that loop and most recently have filled it in, are now building mixed use and missing middle kind of housing, multi-level affordable housing, but in a very multimodal surface corridor there. And this is Rochester, New York. This isn't Boulder, Colorado, or Portland, Oregon, one of the socialist enclaves that's supposed to be way ahead on this stuff, super progressive. Regular middle American city that has realized these benefits will confer not only on the local economics and arguably the environment, but also on public health. Getting people moving again will lead to a healthier population. And indeed, this is an article that I'm going to tell you don't have to read because I'm going to summarize it for you. I was a co-author. It's a position statement, really a policy statement from the American Heart Association and their journal Circulation that essentially says, if we put in place the kinds of policies that support active transportation and therefore get more active transportation, and that, by the way, is land use as well as transportation policies, you can't look at them in isolation. It's how they mix together to create more opportunities for walking and bicycling and transit use, the active travel modes. What you get is population health improvements, more people being more physically active, not because they're exercising, but because it's built into their day. And I'm going to summarize. There are literally scores of citations at the end of that article, but I'm going to suggest to you that really we found when we did that the literature review for that, basically 4 things characterize settings where you tend to see people walk, bike, and take transit more. And they are classic new urbanist principles, right? You tend to see a greater mix of nearby destinations, right? Live, work, shop, play, learn, pray are intermingled rather than segregated by use. There's a quality network of facilities for the active modes, walking, bicycling, and transit. The details of design reward you rather than punish you for being a pedestrian or a bicyclist, and it is truly safe and accessible for all. Importantly, this happens therefore on 3 scales: the macro scale of land use, where stuff gets built and where different uses are; the mesoscale of the connecting fibers between those land uses, right, the networks; and the micro scale of design, the placemaking that makes us feel comfortable there as a pedestrian, a cyclist, a transit user. And it's really functional for those users. So it's important to always think about all 3 of those scales. And I would argue there are many, many policies but that inform and support this, but that is as long as a year ago, I did a review article for this journal, and it's notable that it's a health journal. The journal Childhood Obesity came to me and said, do a review, tell us what you think is going to help us turn the tide on the childhood obesity epidemic that we're facing in the US. And they figured I was going to talk about stuff like phys ed programs and school nutrition and exercise classes, youth sports. And I said, I think it's this stuff. And I think the evidence supports that. I think the evidence suggests that we got to build a world for what I call free range kids, a world where kids can still hop on a bike and ride a bike to a friend's house, to school, walk to a bus stop, participate in the life of their community without having to be driven everywhere. And therefore, and these are all familiar to all of us, the notion of compact mixed-use zoning and affordable missing middle housing or complete streets. Transportation trails in my lingo means trail networks that are not just for recreationists, right? People who are going to put their bike on their car and ride out to the edge of town to a trailhead to ride, but rather the trails that actually connect the very destinations we all want to get to in our communities. So I think that's the setup, right? I think we're all in this space. If you're on this webinar, you're probably, your head's already there, right? I believe in multimodalism and new urbanism and mixed use and all of that. The problem is we get this rebuff. You know, when I do this work in communities, it is not uncommon to hear these three things. These are the most common kind of challenges I hear. You know, we don't really have the technical know-how. We're not a big metro center. I don't have a 25-person planning staff. The technical details of this rewriting our zoning ordinance beyond us. Second is it's going to cost too much. This complete street stuff sounds great, but it's going to make every road project twice as expensive, right? They amplify the fear of the cost. And last but not least, I will always get that, yeah, well, that's fine for there, right? But that would never work here. And there is usually what they perceive as the communist enclave within their state. So in Texas, it's Austin. In Colorado, it's Boulder. And Oregon, it's Portland or Eugene, right? Somebody's got the there. In Wisconsin, it's Madison, right? Often they're the university towns that are forward thinking and are doing this kind of work. So I actually have answers to these. I really think, and I think we need to equip ourselves to, and I think Kalamazoo is a great example of a community that is in fact addressing these very directly. But these are my 4 key points. I think this is a public health priority, and therefore we should be partnering with public health. It shouldn't just be planners and architects and engineers and economic development folks having these conversations. 2, the knowledge does exist. So even if you don't have it, it's available and it's readily available. The return on investment is very clear. So don't complain about the cost. It's an investment you must make and you will see return. And I believe that for the communities that are hesitant, a pilot to policy approach has proven very effective. Put some stuff on the ground, prove to yourself it works. And this pictures on the right, these are young people, high schoolers in Rio Grande, Texas, right down on the Mexican border between McAllen and El Paso. They wanted to look at some intersections that should have crosswalks, so they painted black tar paper and made pop-up crosswalks just to prove to themselves that they would have impact, that drivers would respond. And by the way, neighbors, as soon as they put these on the ground, they said, are those permanent? Those are great. And they said, no, it's tar paper. It's going to be gone in a couple of days. And they said, well, we need to make it permanent. So demonstration projects like these can make a huge difference. So regarding the 3 rebuffs, again, 1, I think there's plentiful design and policy knowledge. Our good friends with the National Association of City Transportation Officials, NACTO, a lot of us know it as, done a great job. There's a library of materials, the Urban Street Design Guide, the Urban Bikeway Design Guide, Transit Street Design Guide, and many, many more. A pandemic guide, a guide that came out during the pandemic for rapid response ideas. That content is out there, and much of it at very low cost. I want to say that sounds like just the road stuff. There's lots of good stuff on land use. I show here stuff from the EPA's smart growth system, putting smart growth to work in smaller and more rural communities. But Smart Growth America, the American Planning Association, lots of organizations are really putting out good information that help guide and inform, for example, updated zoning ordinances that reflect the mixed use we're talking about. I really want to focus on the one on the right here. I think this is not getting enough play. It's called the Small Town and Rural Multimodal Networks. It is published by Federal Highways. Alta Planning and Design help them do it, but the FHWA imprint is on there. And that's important because it means engineers, even the most reticent, may be ready to try some of these things because Federal Highways says it's okay, right? And the nice thing about this small town guide is it's not just for small towns. I find the tools they suggest are for communities of all sizes. Simple tools like pedestrian lanes. The picture on the lower left here, that's Bonners Ferry, Idaho, where we're right near the school complex, middle and high school off to the right. The public works director, everybody agreed that, yes, we need sidewalks here near the school. He said, but I don't have the money right now. So I'd like to stripe a pedestrian lane on the road. And a couple of people said, you know, on the nights when we have a home football game, people have to park on this road. And of course, on parent teacher night, and when we have the school concert, the holiday concert, And he said, wait a minute. So you're saying for 10 days a year when people have to park here, I shouldn't stripe a pedestrian lane? So maybe we could put up some sandwich signs and say, yes, on those days you can park here, but I'm not going to let 355 days of the year us not have a marked shoulder or pedestrian lane here. Let us not let the perfect be the enemy of the good, was really his answer. But my point is low-cost tools that could work in big urban centers, but also very, very small communities with modest resources. The pedestrian lane on the right here in Boone, North Carolina, that's paint and flexible delineators that have, and by the way, fully reversible. If it's a problem, you take it out. But the small town guide also talks about bicycle boulevards, more sophisticated tools, and talks about how they can be done at reasonably low cost and so on. One last point about the technical knowledge evolving, for years, I'm an engineer by training, and we were taught, the important measures of a roadway's performance are its level of service and the average daily traffic that you can move through that. And I just want to suggest that that's evolving. That's not a hard line through those. Of course, they're part of the consideration, but another FHWA document everybody should know about, the Guidebook for Developing Pedestrian and Bicycle Performance Measures, which essentially says, again, Federal Highways imprint on there, says, yes, you can be looking at things like these measures when you're considering how we look at the performance of a roadway beyond just how many cars we can push through. So things like economic impacts on across the economic spectrum, health and equity outcomes. So we're back to the health of the community here. Are people able to get physical activity through active transportation? I also think we got to be ready to make the economic argument. Remember, I talked about the return on investment. So many people have heard of the triple bottom line, the notion that when we design for active transportation, we are improving not just healthy people, but a healthy economy or healthy environment, sometimes referred to as people, prosperity, and planet. And Franklin, Massachusetts, population 20,000, they're doing transit-oriented development. That's not just for big cities because they're on a rail line that goes into Boston, a commuter rail line. So that's where they're focusing their mixed use development. Another article you don't have to read because I'm going to tell you the quick version of the story, which is they convened a national panel and said, what are the best economic indicators of the benefits of designing for physical activity or active transportation? These are 10 of those factors that this expert panel felt the evidence was strong for. And needless to say, things like retail sales and employment, you've perhaps seen these kinds of studies. What happens when we make a street a more complete street or multimodal street? We see retail activity go up, tax revenue go up, mix of users increase, multimodalism occurs. And so that's one of the strong arguments for complete streets. And people will say, yeah, but it costs a lot. Well, Urbana, Illinois realized when they were going to repave this road anyway, the cheapest way to do it was during the repaving project, turning it into a 3-lane or doing what we call a road diet. And if you look closely at that photo, that served all 4 user groups. It's going to be safer for cars because you don't have to turn across 2 lanes of oncoming traffic and you get out of traffic when you move into the center turn lane. Man, we got room for bicycle lanes, center median islands for pedestrian crossings, and that's placed right where the bus stops are, so we're serving the transit user too. In other words, a multimodal road that serves all 4 groups, including the automobile driver better. And when's the cheapest time to do it? Well, I like routine accommodation, when we're doing the work anyway. Hutchinson, Kansas was about to repave that road. We had done a walk audit there, identified it as a candidate. A year later, they sent me this photo of the road diet there that changed the character of the road simply by moving where the stripes are, right? Where we painted it. By the way, another FHWA document incorporating on-road bicycle networks into resurfacing projects. Are you getting the theme here? Yes, even the national roadway organizations, right? The guys that were often used as the excuse to not be able to do this are acknowledging these techniques in building more walk, bike, and transit-friendly spaces. So the economic pull is clear. There's market demand. People want to live in these communities. They perform better economically. Developers are increasingly interested. What are we going to do with that whole first and second generation of malls and big box stores and surrounding parking lots? What are they going to look like when they redevelop? And there are quantifiable health benefits. Up in the top right, that's an actual link to a website, the National Collaborative for Childhood Obesity Research, another health organization, has compiled a website with lots of resources to make the economic argument for physically active transportation and land use decisions. Last but not least, never work here. Well, have you asked? Have you even tried? It's pretty easy to say that when you don't do anything. So how about some inclusive community engagement? Let's get people out for inclusive walk audits, and let's make sure they're interdisciplinary, have our team there. Ennis, Montana, we did an inclusive walk audit. They identified that location in the lower left for a possible curb extension. And to their great credit, they tried it. In the picture on the right, that's just paint and vertical delineators, could all be removed. But on walk to school day, they had that installed to see, would these curb extensions make it safer for crossing pedestrians? Here in Whitefish, Montana, parents will never let their kids ride their bikes to school. We have these big logging trucks. It's dangerous. Well, what if we created a protected bike lane? Well, what'll happen is we'll fill the schoolyards with bikes, right? And that photo is from Walk and Bike to School Week when they created that temporary bicycle lane. So we find these pop-up demonstrations are a great way to get people thinking differently. Last example, in Billings, Montana, again, part of their Safe Routes to School initiative identified this as an important crossing. Public Works says we don't have the money to actually tear the road up, put in curb extensions, but we can use these low-cost materials to demonstrate it. And by the way, in the interim, when we pass a complete streets policy and this road comes up for repaving, it's coming up in the cycle anyway, we'll build it like this. We'll make it a complete street because we've passed the complete streets policy, and we used the low-cost example to prove to ourselves, yes, students will in fact cross here. It's not just roads too. I think we can do this with land use. This is a pop-up food park in a parking lot in McAllen, Texas. And on the right, on an overly wide road in Salt Lake City, they've created an entire community garden and festival space with basically found materials, right? Those are shipping containers and pallets. The point being, we can create those walk and bike to destinations as well as the networks that get us there. And there are great resources out there. Indeed, I'm going to tell you that in my PowerPoint, I've got a dozen additional resources. We won't go through at the end, but if you take advantage of getting the PowerPoint afterwards, you'll have all the links that I've shown you and the resources. So I think the answers are out there. I think we have good evidence that there's plenty of technical information, the how to do it. I think the economic argument is clear now. I've got plenty of evidence it's a winning investment. And you can start, if you're concerned with low cost, simple approaches, routine accommodation, build it into what you're doing already. And I would urge you to partner with public health because they get this and they're really good at making the argument and they're really good partners. And if you say, my God, this guy is a raving lunatic, he didn't take one breath in his entire comments, and it's because I've realized these are my kids who are now 25 and 27, but when they were this age, we were anticipating a potential decline in life expectancy among their generation based on chronic diseases, by the way. And it's come to pass. Before the pandemic, we had seen a reduction in life expectancy in this country, largely attributable to the diseases of sedentary living, cardiovascular disease, type 2 diabetes, osteoporosis, and its complications. We can do better for them, and we have to. So engage public health folks in this conversation as you build the new urbanist world that we all aspire to. And with that, I'm going to ask Rebekah to give us a really good example of how that's happening in Kalamazoo, Michigan, because they're doing some great work there. I've had the good privilege of visiting and seeing it.
Thank you so much, Mark. That was an incredible set. And I hope that what I can show you is that we're doing this in Kalamazoo and how we got it done as well. And I'll also have a bunch of resources for you. You can go to our imaginekalamazoo.com website. You can follow a bunch of the pilot projects that we are working on. And you can see the progress that we're doing, because that was one of the biggest and most important things in our community, was to allow everyone to see what was going on. And so when we started Imagine Kalamazoo, I was city planner, and I decided I was going to do the unthinkable thing and try to reach out to as many residents as humanly possible. I had no consultant, and I had $25,000 to write a master plan. But that's where innovation is born. And I wanted this new plan to be written as a work plan for my staff, to actually have an implementable master plan. And by engaging so many people, I created a self-fulfilling prophecy, right? You can't engage nearly 10% of your population and then not do what they've asked you to do. That would be horrific. And so I was able to spend the rest of another big chunk of my career as the director of community planning and economic development, implementing this plan. And one of my other bright ideas was that I would celebrate this every single year. And so that's this timeline. And every year I bring to my community and to the city commission how far we are in implementing our master plan. And it has done some pretty incredible things. Like, for one, it's created trust. And that trust started by our outreach. And I'm using this analogy of setting the table because I feel like a lot of planners use it. Oh, we're going to set the table. We're going to set the table with transportation. We're going to set the table with zoning. And the thing is that we're not always setting the table for the meal that the community was expecting, or we're not setting the table quite in the right way. So the community might be asking for a steak dinner, and we served a steak dinner, but we served it with a spoon. We haven't always given the community the full range of what that project could be, because we haven't really gotten into the details of what's necessary. You might be able to give your guests a bowl of water and they might go along with it, but their experience of what that truly is on a daily basis may not be what's necessary for your community. So if you're going to do deep engagement and deep listening and be intentional about implementing your plans, this is where I want to help you think about how you're going to set your table for the outcomes that you actually want. The first one was really thinking about the healing and happiness of our city. If you haven't read Happy Cities, you need to get a copy of Happy Cities. In fact, we're thinking about doing a citywide reading of Happy Cities for our community. And that's because while the engagement process gave us input on what the community wanted, we also needed to return and say, here's some educational things that we want to give you. Because the way that things are actually implemented are totally different than they were before. Mark just gave you a ton of examples of pilot projects, and the way we implement things now and test things are not just like, well, let's just get that construction budget together and, start building. No, we want to test. We want to do these pilot projects, and we want to set them up for success. So we need to communicate better with our residents and our visitors so that they understand, oh, I see what you're trying to do here now. I didn't get those bollards. I didn't understand this paint. I didn't know what you were doing here. They have to understand the way that you are actually implementing your new work. You also have to realize that zoning caused as many ills as it can do fixes. So acknowledge that, acknowledge where you had made mistakes, and think about the ways that you're going to heal your community from that. Think about the ways that you've made transportation decisions and how they are now evolving. Just like when we talk about level of service, we need to talk about level of service for all the users, not just the vehicles. We're so used to talking about it in one particular bucket. Everyone needs to learn that there are so many more buckets now. And so educating your community along with the outreach is one big step that I encourage you to make. The second is land use and transportation. You're going to hear it for the rest of your career. So get it together, guys. It's a secret sauce. There's 3 ingredients. You got to put that land use and transportation in your master plan. Just get it done. The second thing is you're going to do your complete streets policy. And the third, you're going to do a street design manual. I know you're thinking tiny little town, but here's the thing. Your master plan is your vision. So you've set that vision, that philosophy up for your community. The complete streets policy says, okay, everybody, here's our roadmap. This is what we're going to use to all go in the same direction together. And then your street design manual says, these are my procedures. Everyone from top to bottom is going to understand what that street's going to look like if you have a street design manual. So I call it the secret sauce, and it's got to happen with your land use and transportation. It really will make a profound impact. When you know what your street is going to end up looking like, it's like your town just changes overnight. It really is an incredible example. I'm going to talk to you a little bit more about the repair and reconnecting. I said a little bit about zoning, how zoning can really hurt the work that you're trying to do and how it can also help. So frame that in the terms of repair and think about how just our example was severely divested neighborhoods that had an historical lot size of about 32 feet. Then come in 1966 and say, nope, lot sizes should be 66 feet. And we suburbanized our most disinvested neighborhoods. And that would mean for a city that actually looks to property taxes for their revenue, a huge divestment, because now you would have to demolish 3 homes to build one that conformed with your zoning code. In 2019, we repaired our zoning code by saying 32 feet. Absolutely. That is an acceptable lot size in our city and was in the past. And we went from 67% of our residential zoning being non-conforming to now at 1% of our lots being unbuildable in our 25 square mile city. It's been a game changer because when you think about the lack of housing that we're already facing, and Habitat for Humanity can't build there, none of our nonprofit housing builders can build there. Private market isn't going to save us. This is where I have to say I'm so excited about all of the pre-permitted plans work that is happening out in the world, but you're not going to get it done if you don't get your zoning right. You've got to have this realization that there's a reason these things aren't being built. There's a reason missing middle housing is not in your area. And you've got to do the work yourself to get really familiar with those blocks, really familiar with those lot sizes and understand and how to calibrate that zoning. We've been doing ours very, very slowly in Kalamazoo. We chose not to just go in and work for 2 years to do the zoning code. We've been doing it very incrementally. We knew that this was the first dial that needed to be changed. And then ever since then, we've been opening up more and more to get us ready to implement those pre-permitted plans. And that's where we go. It's our housing boom, 0 to 48. But if you think about 0 for 10 years doing nothing to 48, so that was 42 new single family homes, 3 duplexes and 3 ADUs. We never had a duplex built in the city of Kalamazoo for 10 years. So we're getting that missing middle housing, but we're doing it with our nonprofit housing partners because your private market still isn't going to come in if the comps aren't there because you're not going to get it financed by a bank. You start to see where I'm going with how to set your table. You've got to understand how every single one of these things works so that you are setting the table for exactly what you want. So to reiterate what Mark says about policy to project to, and the pilot that happens in between, you've got to think about what those family and those guests, drinking that bowl of water. And, did you choose to serve them hot water or cold water? Did you put some sparkling water in that bowl? Like, what did you think about how that's going to work out for you, right? If that's a pilot project, you're going to get some feedback and they're going to know it's just temporary, right? But if you can let them in on the process a little bit more, you can save a whole lot of money getting it right. And so we've been piloting everything. This is kind of our list of all of the transportation projects, but know that, like Mark said, it's not just about transportation. It's also about the city beautification projects that you can do, because I believe our transportation projects really can show return on investment. We've seen that, whether it's two-way restoration projects or bike lanes. Many of these projects have shown that economic development will grow around those kinds of street improvements. But the way to gain trust and really begin to feel what your community can become with the land use is to think about piloting things that like composting or recycling projects, home garden projects, all of the kind of sustainability things that you would love to bring into your city are great pilot projects as well. So I'll leave you there. And again, you can go to imaginekalamazoo.com to be sure that you can take a look at all of these projects and you can see how much they cost and how long they've been running. All of our pilot projects we run for a minimum of 3 years to get the data that we feel like we need to be able to make it into a permanent project.
Thank you, Rebecca. Thank you too, Mark, for this really energizing, kind of inspiring presentation of what could be done and what has been done. And I think a lot of people will appreciate the fact that we're looking at this from a multidisciplinary team effort of healing a city. Not just our urban planners and our architects and our designers, but also our public health officials, policymakers, and all of those things. Probably I think one of the bigger questions that most people have is, if you are in that small city and you're a planner for that small city, where do you start? Do you look at an existing master plan and try to figure out how you can kind of squeeze in there, or do you have to kind of do the big lift for asking for a revisit or a remastering or rewriting of a master plan? How did that start with you, Rebecca? And Mark, do you have any suggestions for those just starting? How do I flip the switch?
Sure, that is an excellent question. And it's about taking the first bite of the apple. So if you can think about whenever we're trying to get to an end in mind,
Mm-hmm.
I pull my team together and we start, and there's like 3 of us, right? Like that's the whole team. We don't have a big planning department either. And we start to work backward and we start to say, okay, what's the first thing that we could do, in that engagement or in that education to get to this project? Who else needs to be at the table? And we start to think, what can we do with just paint? What other infrastructure do we need? Can we do curbs? Can we do planters? Can we use pallets? Who are our champions? Who can we think of? Which neighborhood association could we pilot this with? Is this something that we could do in, our Vine neighborhood, or do we want to do this in our North Side neighborhood? Like, we immediately think about the easiest place that it would possibly happen. What tool do we have the best allies at? And
Right.
and then we start to kind of work with that team.
Mark, what's your
I'm just gonna. It's a good question, and there's not a standard answer, because I would argue you've got to be opportunistic. So if you're due to update your master plan, right? If you're about to update your comp plan, then integrate all this in the process. If on the other hand you're not, just as Rebecca said, look at your paving program. What's getting paved next year, this summer, right? This next building season, paving season. We could just take 12-foot lanes down to 10.5, widen 3.5-foot shoulders to 5 feet and make them bicycle lanes. And I mean, you might say, well, that's lame. It's way better than nothing. And you'll have an impact. The narrowing the travel lanes, bring speeds down a few miles an hour. You'll define a space that's a little safer for a pedestrian or a bicyclist on the side of the road. So you've got to be opportunistic. I would say this, though. My number one thing is community engagement. So if you were saying, I don't know where to start, hold a walk audit. Literally organize a community gathering of some sort. And I like walk audits because they are utterly egalitarian. We can walk or roll together. I want them to be inclusive. I'm going to reach out specifically to the independent living group in my community to have some people who are wheelchair users or users of assistive devices or are visually impaired or blind. And so that we can all experience them navigating the environment that we've built that is often very unfriendly to pedestrians, particularly with physical disabilities. So my point is, create an inclusive group, get out there, people across the spectrum of age and income and race in your community, and maybe you do a series of walk audits. What if you could partner up with your city councilors and say, this summer is going to be the summer of walks, and in each city councilor's a district, they are going to lead a walk audit in their district, and city staff are going to show up. We're just going to ask, what would you like here? What could we do to make this a place where your kids could be more free range? And by the way, your seniors who don't drive anymore, older adults who aren't driving, where they could be free range, or somebody who doesn't own a car could be free range, right? Because free range kid is really just an indicator species. So starting with some community engagement that's very inclusive, I think is perhaps the single most powerful thing. Much credit to Rebekah and the process they undertook there, because to her point, once you do that, you got to move. You can't just sit on it. Once
You're held
people have said,
accountable.
this is what we like.
Yeah. Yeah. And I think you also mentioned, Rebekah, that you kind of want to talk about, not only the smaller first steps, but what is the bigger goal? And we talked prior to today about how, really when you think about it, the bigger goal, especially true of small cities or small towns, is that you want to heal it in every possible way. Not just for physical health, as we've been talking about, so making things more walkable, or for, planning for multimodal use, but we're trying to heal from an economic standpoint. We're trying to heal from a social justice standpoint. What are I guess maybe the question is, what's the prescription for it? So we talked about the land use plan and transportation plan, and going into this prescription that we'll call the master plan that we come up with. So can we talk about some examples, Rebekah, that you've had, probably didn't first thought be a public health solution, but something that's going on in Kalamazoo that turns up, it is doing a lot more healing than we thought it would. It's not just bringing down vehicle miles traveled, or it's not just bringing down, car crashes, but it's actually promoting a healthy economy, promoting a healthy environment, and also promoting public health. Is there anything going on in Kalamazoo that can point to that?
Yeah, absolutely. I think our piloted bike lanes are the biggest project that we're doing right now that would hit all of those points. And the reason we're piloting bike lanes is because we're working on a two-way restoration project. So we have 4 one-way pairs that are in our downtown that are hugely wide and really unruly. And they were part of our state DOT. And I say were in capital letters. So, that's another boulder that we moved in Kalamazoo, was we got to take our streets back. And so we are now the ones in control of what happens when you pave it. And so to Mark's point, when we knew those streets were going to be redone and we did a chip seal, we repainted with bike lanes. We took a lane off every single one of those one-way pairs. And we did that now. Our two-way restoration is probably 4 years in the future. We're just now raising the dollars. We've got the RAISE grant for planning. But while we're doing that, we want to show progress. And so we're taking lanes off all of these streets. And that has caused our traffic calming. It has been incredible. We're already seeing 5 miles an hour in a drop. And these projects have been up for about 8 months. We did them last summer. And we also incorporated crosswalks with that. We focused on our schools. We've got the curb, those built curbs that Mark showed you in the photographs. We've got built curbs. We've got lots of pedestrian crossings. And the reason this impacts public health in such a critical way is that crashes in Kalamazoo, fatal crashes in Kalamazoo on these streets, and pedestrian crashes were way high for our size of city. And seeing reductions in all of those fatal accidents, as well as severe injuries, has been a real eye-opener for us. And everybody's going to have this moment where you're like, oh my gosh, I can't believe we didn't do this sooner. Because once you see the results of the work that you're doing, it really does become a profound impact.
Mark, with benefits with public health, we've talked a lot about, you've talked a lot about the health and in terms of accidents and fatalities, and also obesity, particularly childhood obesity. Can you talk a little bit more about chronic health issues, what the benefits are of a walkable city going towards healing, particularly probably with the past pandemic, what that
Right.
has shown us in terms of survivability of those who are in better health.
Absolutely right. So the data is really, really striking. We had known that there are deep social injustices associated with health in our society. So in other words, rates of cardiovascular disease, obesity, type 2 diabetes are far more burdensome, far more heavily on households of lower income, often of people of color, indigenous populations. So, for example, Native American Indians and Hawaiian Island natives, Alaskan natives, or North American. So, in the point being, in each case, it's the imposition of sort of this new food stuff, right? These kind of the high fat, high sugar foods that you see sort of in American society and kind of Western society in general. But most importantly, it's a reduction in physical activity, right? The elimination of routine daily physical activity. So we've seen that striation occurred. What we saw during the pandemic was the same thing was occurring among who was getting sick from and, most importantly, dying from COVID. We saw those same populations having much higher risk. And what we began to realize was physical activity is protective, not just around chronic disease, but also infectious disease. So if you were to say to me, write the best prescription you could write to somebody to avoid death from COVID, I'd say mask wearing, hand washing, vaccination, and stay physically active. The data is crystal clear. The Centers for Disease Control has said it. And people that were more physically active, much lower risk. So now we're starting to realize that there's this public health imperative. Think about the roots of planning in this country. It was public health that said we should segregate land uses and make dirty factories be separate from where people live, right? We don't want the filthy smoke from the coal fire and we don't want the water contamination. So it was a public health thing to use single use zoning, right? To segregate land uses. Similarly, lowering density, low density suburbs. Well, but pandemics like the 1918 flu pandemic just burned through the city tenements in New York and Chicago, right? Lower density, that's a good thing. So we had good intention, not realizing we were going to then afflict ourselves with all these chronic diseases associated with having to drive everywhere. So it's really, really important that the public health conversation be a part of this. And I would argue this is social justice because the public health people are saying, I want everybody to be crystal clear about this. We are now saying your zip code is a better predictor of your life expectancy than your genetic code. Where you live, place is so important to your access to healthy foods, to your physical activity opportunities, and I would argue social connectivity and all of the other social benefits, the mental health benefits that come with being in a connected community, right? Coming out of the pandemic, what are we seeing? Rising rates of depression and sense of social isolation. Live in a walkable community, I can help reduce that. So the benefits are myriad, and we can't say enough about their importance right now, especially, Marsha.
Right. And I think everyone can argue that public health is a bipartisan issue. So it's
yes.
It's not something I think you should feel as an obstacle to changing policy or to go in the direction that you want it to go as being more of a liberal's dream utopia. We're talking about people's health, which is not up for political discussion. I don't think it's either serving your community and helping them to be healthy, or you're paying for the consequences, both population wise and economically. Well, we have a lot of questions from our viewers, so I'm going to get to those so that we don't run too much over time. The one question for Mark is, do you think a 3-lane road diet would work with an ADT of approximately 27,000? How essential is it to have state DOT on board, as this is a state road?
Yeah, I tried to pop an answer in there, but the bottom line is I'm shocked at some of the roads. I've seen up to 30,000 ADT successfully have road diets on them. And a lot of people will say, no, 20 is the number. We used to say 10 was the number, or 15,000, right? We used to keep thinking, what we're realizing, it's about the details of design, what happens at the intersections, because the intersections are often the flow governors, not what the lane, carry capacity is. So for example, you get to an intersection, it's a big signalized intersection with a lot of left, right turn, slip lanes and all left turning movements. That's what's going to govern what your throughput on the corridor is. Go to modern roundabouts, on the other hand, then a 3-lane alignment with modern roundabouts at intersections can carry surprisingly high volumes with no worse delay, and most of the time with much lower delay, right? Even at peak hour, though, the delay won't be any worse than a signalized setup. So bottom line is, it has to do with your turning movement, you know, how many driveways and things like that, you know, how much you're going to use the center left turn lane. Will you do medians at intervals to make sure it doesn't become just another through lane? So the design details matter, but my experience is yes, and indeed, yes, the state DOT is going to have to be involved if it's a state route. I will say this, we are seeing movement. In other words, depending on what state you're in, and we won't pass a judgment, but there are states that are ready to do this stuff now, and there are others that are moving up the learning curve. But, you know, some more FHWA documents that I included in my summary resources include ones on road diets and recommendations around that. So Federal Highways is weighing in on this, meaning the more reticent DOTs, state DOTs, are also moving in this direction.
Great. Okay.
Yeah. It's a great question because it's a very timely one now. People are
Yes.
doing this kind of work.
Right. Rebekah, were complimentary public transit services incorporated into the prescriptions for your community at all? And if so, were there any specific needs or designs for them?
So we do have a public bus system, and we do keep our lanes to 11 feet wide. So that is kind of our standard. The buses like us to keep that for 11 feet. We have also made sure, like when we're placing our curb extensions or we're placing our bollards, we do a test with our buses, make sure, and the fire truck. We also use the fire truck in our tests too. So there's lots of times where we'll set up a pilot project. We'll grab a bus driver and a fire truck and make sure that we've got the design correct before we open it up to the public as well. So yes.
Nice, like a transit audit.
Exactly. Yep.
Great. And I saw that you're trying to type in an answer for the use of the term two-way restorations.
Yes.
Yeah, and I would love for Mark to answer this one because he taught me. And so I feel like that is a great one for you, Mark.
Thanks. Well, and I give Ian Lockwood, a good friend and colleague, credit for this because he's the first. So we were talking about one-way conversions in a one-way to two-way conversions in a community, and we all got talking about it. And he said, you know, we're restoring what was here originally. We should be calling these restorations. We should always, because you're just restoring. Most of these street networks had two-way streets that worked wonderfully, not just for cars, but for pedestrians and bicyclists and right, certainly transit riders, right? You put in these one-way couplets and you really complicate it for lots of the users and tend to bring up speeds because it's really about evacuating the city and the suburbs, right? I mean, that's so often what the one-way pairs were for. So let's call them restorations because we're restoring and only use that language so that nobody can challenge where did this idea come from? It came from what this was originally. And we're restoring what was here and worked well for so many, many decades.
Agreed. Okay, another question. What is a good model of a policy guide for implementation of the Complete Streets Guide as well?
I threw one in the chat. I think I put the link in for, of all things, Springfield, Massachusetts. We've been doing work out there. They have a great complete streets policy. The Pioneer Valley Planning Commission, PVPC, worked with the city of Springfield, that's Central Mass. It's a classic example of those kind of medium-sized cities. They are putting lots of great complete streets infrastructure all over. They just did a big redesign of a six-way complicated intersection with a modern roundabout that won an award from the Society of Civil Engineers. So they're really doing state-of-the-art work. Here's the point. The manual is 24 pages long because people get overwhelmed by this. Now, I'm not saying everybody wants only a 24-page, but I think it's a nice example of an elegant and simple document that informs what they want to be their standard practice. What they're saying is, look, on local collectors, we should be using these techniques, and on larger streets, we should be doing this. But we should be thinking about all four user groups all the time. And here are actual profiles that give you a sense, and cross sections that give you a sense of what this can look like. And these should be our defaults. Not the old sort of multi-lane arterials. It's just about level of service and average daily traffic. And a manual like that then gives license to the Public Works Department, and they have a great one. These guys and men and women are really doing great work to make this reality. And they're doing a lot of what Rebekah talked about as part of their routine paving program. When we're touching a road anyway, they knew they had to reconstruct this intersection. That was the time to not just re-signalize it again and make the signals fancier, but to actually tear it out and put in a roundabout. Long term, by the way, they're going to make up that cost on the lower maintenance costs. Oh, and by the way, the roundabout's going to work when the power goes out. You know, every time they lose power in New England, right? Because we had another New England storm, roundabout's going to work just fine. No, we don't have to worry about the lights. There's just so many reasons these roundabouts are better. So that's just a great example, though. Look at their manual. So that's in the chat. And it's just one. There are plenty more, but it's a good modest example, so you don't get overwhelmed by the idea of trying to do this.
Yeah. Rebekah, was there a complete streets guide that you were using? Or is this kind of all the brain power of your staff that?
No, we have a complete streets policy. Our policy is about 5 pages long. It's on that imaginekalamazoo.com website. If you click on the plans link, you can see all of our plans. And then right next to it, you'll see our street design manual. And so that gets into some of the details that Mark's talking about, you know, about the roundabouts and what's appropriate and where they go. With our land use and transportation being in our master plan, so we use our streets. Okay, here I'm going to get nerd out for all my planner peeps out there, right? So we use our streets as a regulating guide. Okay, so you'll see the different classifications of streets that help to inform the zoning on the regulating side. And so that's how we use the street design manual. So you'll go to the section that's, you know, main streets, and you'll see, oh, okay, here are all the different, you know, reasons we want this main street type and why we want it here in our city. And so you'll see that map where we've mapped out all those corridors, economic development areas. And we know that for streets to be really successful as a main street, then they need wider sidewalks and they need parking, you know, on street, and we need good connectivity for our non-motorized network. We need to consider loading zones. We need to think about public transit. And so it gives you this menu, you know, it starts to really shape out like, oh, yes, I want that character for this street. And that's why I say, get to know your city. Understand what you want that street to become. How is it functioning? And know this, right? Like the street might run through 5 miles of your city, but it might change 3 times, right? It goes from neighborhood to that little neighborhood center, back to neighborhood, back to, or maybe it changes completely because it's about to loop with a interstate or something like that. So you think about how your street design manual kind of sets you up for success in terms of what are the elements that make that part of the street really successful within its context as well.
Excellent. I have a personal question because I will take off my CNU hat and ask as a public citizen. I live in a small town where there are a lot of, because I think this whole town was built right at sprawl peak of industrial and office parks, business parks. And since the pandemic, those are huge empty spaces now. So we've got a whole bunch of buildings that are only half occupied, if at all. We've got huge parking lots with maybe 4 or 5 cars in them because those are the only ones who are required to go back into the office. Where do I start with trying to find someone who can better address that issue? Because I don't want to have to look at it every single day and think there's got to be something that can be done. It can't be obvious to just me as somebody who's in this industry and who thinks about these things. It's along the side of a major road, so it can't be just me who's trying to hope for something more visually interesting or useful for that space, to make us all happier and to make it more of a town and not a town for this business, but a town, you know, that we can all enjoy.
Yeah.
That might be a hard question.
No,
that's a curveball I kind of threw in there. But
do you want to start? What? You want me to start? Okay. So what I would do, and especially if I've worked in economic development in my city now for about 9 years. So I have pretty good relationship with both, who would be the neighborhood leader in that space and also who's the owner of that building, right? And I think those are two really good relationships to have to begin with. And then you can layer on kind of the third piece, which might be, who can I bring in, or what can we do if I engage my developer and my neighborhood leaders and say, okay, what would you guys want to see here? Is it a retail space? Is it an office space? Is it something fun for kids? Is it a restaurant? Like, what is it? Then going to that developer, we say, can we pop up a restaurant here? Can we put picnic tables out in the parking lot? Can I host a food truck rally here? What can I do to bring something of interest?
Can I put up some basketball hoops and pickleball courts? Everybody wants pickleball. You got all that parking, pickleball it, right?
Everyone takes a lunch break.
Yeah, activate the space with something to bring attention to it in a different way, right? Like right now, the attention that it's getting is like, I don't want to see that. Make it go away. And now you need to bring, you do need partnerships. You've got to have relationships and partnerships that help spark the fire on this. But, if your community brings forward a $5,000 grant or something like that, I mean, we have got lots of great philanthropy here in Kalamazoo where, a $5,000 ask to throw a food truck rally and, get some neighborhood association to really pump it up and make it a party wouldn't be out of the question, so those are just some
so what you're hearing there is start to use what's there right now, right? So many of these office parks, by the way, had things like, ponds and sometimes trails and things like that. There are assets that sometimes can be quite pleasant. So jump on those, do that. And then big picture though, find the developer because they're out there. I mean, I've got some compelling images of big box stores where they had to rip up the zoning, by the way. The zoning would have never allowed them to do this, but where the surface parking got turned into parking boulevards, facing sets of buildings, multi-story, residential above retail, and all of a sudden you've started to repopulate. Now, not everywhere can become that. Not everywhere can become a village center or something like this, but I love showing, like there's one in Winter Park, Florida that was called Winter Park Village, which was utterly ironic because it was big box stores surrounded by parking, right? It was the opposite of a village.
Right.
The rewrite of the zoning allowed it to villagize by creating these parking lanes and rather than surface parking areas, roads, basically streets, with facing sets of multi-story buildings and most importantly, I believe, mixed use, right? Because once you start to put in residential, they are in fact the first patrons, the first customers for the businesses there. So you don't get that 10-year turnover that a big box mall or a store, a strip mall absolutely has, right? Those are financed on a 10 to 15-year timescale, 15-year timescale, because they know that's about their lifespan. How tragic is that we're building at that level of, kind of expendability? And we can do better. We can do better. So so you start with exactly the stuff Rebekah talked about. Get people thinking about these spaces differently, and then say, okay, and what could it be? And then find that enlightened developer or remember the building owners eating horrible taxes right now would love to make this be more useful space, right? Get tenants again. Okay, what does that have to look like? And can changing zoning or putting in an overlay help you get there?
Excellent.
So I wanted to say that we're a little bit past the hour point right now, and we will be posting the video of this online tomorrow, and letting everybody know with a follow-up email that is posted. And at that point, we'll also try to include a link to any of these resources that we've been talking about. So I don't know, we could talk a few more minutes if we have any parting thoughts or if there are any more questions that we haven't gotten to.
I'll just say that I tried to attach a document that had most of my resources in it. I had them in a Word document, a PDF. So I threw that in the chat. So if it came through as an attachment, maybe somebody could just give me a wave and say, yeah, I was able to download it. And I tried to have hot links in there so you could just go to some of those. And there are a lot of good ones. And I did make this point in the chat. most of the stuff from federal highways and a lot of these organizations is free if you're downloading, if you're not trying to buy a printed version. And then there are print costs associated if you want a printed one, but well worth it. Doing a little, somebody talked about their bookshelf getting heavy, and that's great. Great.
It looks like that resource thing does work.
Okay, good. Thanks. Thanks for checking that.
Have a click on it. Well, I think, I want to thank everybody. Thank all the participants and the panelists. This was really a lot of fun. It was a great show. And I really appreciate the effort that you all put into it. And, until another time, we'll have another On the Park Bench in a couple of weeks. And I look forward to talking with Mark and Rebekah sometime soon. Yeah.
Thank you.
Thank you so much for having us.
Yeah, thank
Sure,
you.
no problem.
It was a pleasure.
Great to be with you, Rebekah. Looking forward to visiting Kalamazoo. I can't wait to come see you again.
No, 2A, come on.
Cheers, everybody.
Take care.
Yeah.